Can the NHS truly be digitalized? The government plans to set a 10 year plan framed around three big reforms, which are to make the NHS fully digital, shifting more care from hospital to communities, moving from sickness to prevention. Hello everyone, welcome back to my channel. Whether you are new or returning, thank you so much for joining me, and if you haven't already, don't forget to subscribe and hit the notification bell so when I upload any video, you'll be the first to be notified. In today's video, we are diving into some major news about the NHS. The UK government is taking steps to push things forward. Whether they are making the right moves or not is up for debate, but there is definitely excitement in the air. Let's watch this video together and then discuss the findings later. Stay tuned.
So this government is working at pace to build a 10-year plan. Something so different from anything that's gone before. This plan will be framed around three big shifts, three fundamental reforms, which are rooted in what Lord Darcy has set out today. First, moving from an analogue to a digital NHS. We can already see glimpses of the extraordinary potential of technology, like the world's first ever non-invasive, knifeless surgery for kidney cancer. Just imagine that. It's pioneered by Leeds teaching hospitals. Or the precision cancer scanners. I saw some of them yesterday. Or simply transforming how we manage a condition. We went to Kingsmill Hospital earlier this year and met a 12-year-old girl called Molly. She's using her smartphone to monitor her glucose levels, instead of being forced to repeatedly prick her fingers. It made such a difference to her daily life and gave great reassurance to her mum, who could remotely check on the settings and the findings. So we've got to make these opportunities available to everyone. We've got to use technology to empower patients and give them much greater control over their healthcare. Take an innovation like the NHS app. This could be a whole digital front door to the NHS. Appointments, self-referral, reminders for checkups and screenings, patients in control of their own data, healthcare so much more transparent, so you always know your options and the standards that you should expect. And you know, earlier this year I went to Alderhay Hospital. Many of you will know it. It's a fantastic hospital where they carry out heart surgery on infants, which is really humbling to see. And I met the parents of a 2-year-old who'd had extremely complicated heart surgery. Tiny infant, incredible surgery. I asked the parents about their child's history and conditions. How did he come to be here? What's the story behind this? And as they told me, I could see them welling up as they went through the history, the conditions, all the background. And then they told me that every time they went to a different hospital, they had to go through all of that over and over again. They really struggled to tell the story, and they had to do it every single time because the records weren't held electronically. So we've got to have fully digital patient records so that crucial information is there for you whenever you go to the NHS. And while I'm on technology, we're also going to throw the full weight of the British government behind our world-leading life sciences. Second, and Sarah mentioned this, we've got to shift more care from hospitals to communities. Now, the King's Fund has long called for this. Successive governments have repeatedly promised it. But what's happened? The opposite. The share of the NHS budget spent on hospitals has actually increased. Now, this 10-year plan has to be the moment that we change that. The moment we begin to turn our national health service into a neighbourhood health service. That means more tests, scans, healthcare offered on high streets and town centres, improved GP access, bringing back the family doctor, offering digital consultations for those that want them, virtual wards, and more patients safely looked after in their own homes, where we can deal with problems early before people are off work sick and before they need to go to hospital. And we have to make good on the integration of health and social care, so we can discharge those 26 hospital worth of patients, saving money, reducing the strain on our NHS, and giving people better treatment. And third, in terms of the shifts, we have got to be much bolder in moving from sickness to prevention. Now, we've already announced NHS health checks in workplaces, blood pressure checks at dentists and opticians. But that's just the beginning. Planning for 10 years means we can make long-term investments in new technologies that will help catch and prevent problems earlier. And there are some areas in particular where we've just got to be more ambitious, like children's mental health or children's dentistry. You know, one of the most shocking things that I saw, this was actually when I was at Alderhay Hospital again, I mentioned the heart operations, but whilst I was there talking to the staff, it became clear that the single biggest cause of children going into that hospital between the ages of 6 and 10 was to have their rotting teeth taken out. I couldn't believe it. I was genuinely shocked.
So guys, what do you think about that? So let's discuss this. One of the big shifts is the introduction of fully digitalized patient records. This is incredible, right? Because let's face it, it's exhausting for patients to be asked the same questions over and over again. However, if patients' up-to-date records were available on one platform, healthcare providers will have immediate access to all the important information, streamlining care and saving time. But is this possible? Imagine a total or global IT breakdown. If that happens, wouldn't patients' personal and medical data be at risk? What's your take on this? Or if there was an internal IT or departmental breakdown, how is that going to work out? Is it just me who is thinking too much about it? Does that mean that the government is planning to tighten their security around the NHS digitalization? What do you explorers think about this? Okay, let's move on to the next one. The Prime Minister also mentioned moving the national service into a neighborhood service, implementing more tests in communities, more virtual wards, and making GP services better. It's about time, but this all is going to take a long time, right? Because this is a 10 years plan. Nonetheless, this all sound really good, as it will lift a lot of load off the NHS. Perhaps it might improve bed spaces and waiting lists would be hastened. But one of the things that I haven't heard the Prime Minister mentioned is about staffing, how the NHS is really understaffed. Hopefully, with this new scheme of moving the national service to neighborhood services, where tests will be carried out in the community, scans done in the community, perhaps this can also increase staffing numbers and prevent short staffing within the hospitals. So the third point is moving from sickness to prevention, and NHS health checks in workplaces will be implemented. Technologies will be put in place to help catch and prevent conditions, and that's great. Hopefully all these things will be put in place sooner or later, and less people will be needing to go to walk-in centers, to emergency departments. Nowadays, when you go to the emergency department, the waiting hour is crazy. So hopefully when these things are put in place, those things are going to reduce as well. I'm just hoping. What do you guys think, explorers? Thank you so much for watching this video once again. And it's your girl Susu here. If today is your first time, guys, please don't forget to subscribe and hit the notification bells when I upload any video. You'll be the first to be notified. So guys, kindly share this exciting news to others. Do not keep it all to yourself. And bye bye for now. It's a wrap. I will see you in the next video, guys. Bye. Peace and love.